cancer is exhausting. It's an exhausting, lonely journey. And to have Mindi there, she was my go-to. She was like my Superman. I would tell people I have a rock star case manager, and I'm not afraid to call her. So.
This is Health Insurance Simplified, a podcast series by Sanford Health Plan. The conversation today is about the value and importance of tools like Healthy Pathways, Sanford Health Plan's care management program. Our guests are Mindi, a case manager with Sanford Health Plan, and Robin, a cancer survivor and a champion on how the program helped her during her cancer journey. Our host is Mick Gary.
Hello, I'm Mick Gary. I'm a writer for Sanford Health News, and we're here today to talk about Sanford Health Plan's care management program, Healthy Pathways. We're going to learn more about how it can be a vital tool in helping people sort out some of the complexities of healthcare. So how can Sanford Health Plan's care management services help you? To help with that today, we have Mindi Smith and Robin Roeder. Mindi is a Sanford Health Plan case manager, and Robin is a Sanford patient whose cancer recovery has included a lot of moving parts. Throughout this process, Mindi has been there for Robin, helping her navigate the healing process. So here we are. Let's hear this story. Let's start with Robin. Tell us a little bit about your health journey. Give us a little bit of context for where this started for you.
I was diagnosed with a rare and aggressive cancer called mucosal melanoma in October of 2016. I had surgeries to obtain clear margins, sentinel lymph node biopsy. There was no lymph node involvement. And I chose to do 6 months of a harsh chemo, cisplatin and Timidor. And as of May of 2017, I finished the chemo and I was declared in remission. I stayed in remission, actually NED, which stands for no evidence of disease, for 6.5 years. April of 2022, I came into Sanford for my first annual PET scan, and lo and behold, a pesky lymph node lit up. And that started this 2-year journey. After the diagnosis, there was a biopsy and it was determined it was the mucosal melanoma. I did 4 infusions of Ipi-Nivo, which is Optivo Yervay. I finished that in October, end of October, and within 10 days I developed acute pancreatitis, and I was hospitalized for that. I got out of the hospital on Friday, and Monday, after I was refused a PET scan because of high glucose, I thought his machine was broke. In fact, I told him his machine was broke. Mindi called me that night. And at first I thought she was selling something. and I was a little delirious because I had really, really high blood sugar level, and incoherency is part of that. And as I got to talking to Mindi, I realized, she's not selling anything. She's calling here to help me. That's the night Mindi saved my life and sent me to the ER.
How are you feeling today?
Today, my cancer has came back. It's in 2 spots. I'm taking part of a clinical trial at Sanford, which involves nanoparticles. Sounds kind of space age. And it involved radiation, and right now I'm doing Keytruda, otherwise known as Pembro. I have scans at the end of next month and to restage the cancer and see where we're at.
So how did you find out about this care program? How did you get aligned with Mindi?
She called me after I was hospitalized as a follow-up, after you get released from the hospital, to see how I was doing. And that's when I started telling her about how I was feeling, and she guided me to the ER that night. And then she has continually followed up with me and called to see how I'm doing. As I traveled this journey, I got a referral to a major cancer center that's familiar with this rare cancer. It's so rare that not every doctor, in fact, it'll take 2.5 careers for a doctor to see mucosal melanoma. So I wanted to not only have my team locally, I also wanted to have a high-volume team on board. And Mindi was instrumental in all of the hiccups and setbacks that accompanied that referral.
What was it like to all of a sudden have this resource? When I'm sure that, as you described it, 100 things coming at you 100 times a day, to have this resource where you could make this call and you're going to be able to talk to somebody who can give you some information that's going to help you.
Oh, it was such a relief. I mean, cancer is exhausting. It's an exhausting, lonely journey. And to have Mindi there, she was my go-to. She was like my Superman. I would tell people I have a rock star case manager and I'm not afraid to call her. So she really took a lot of the load off of me, not only with her medical knowledge, but her knowledge of how the systems work, how the authorization process works, how everything in the insurance realm works that most patients aren't aware of. Not only her medical knowledge and her knowledge of the systems, but the mental health and the emotional support. I mean, there were times I called her in tears. And she would talk me down from the ledge and say, okay, how are we going to come back from this? And she was just a great support.
My next question was going to be, how do you describe what she does when you're talking to other people? And you kind of touched on that a little bit, that, my goodness, you've told us that she's been a huge part of your recovery and continued treatment.
I have a support group, a Facebook support group that's been also very instrumental in my journey. And there are times when there's another warrior that is having issues with out-of-network referrals. And I'm like piping in right away going, do you have a case manager? You know, this is what my case manager did. You need to contact your insurance and see if they have the case management program and get your case manager on board. And your journey is just going to be a lot easier. And with Mindi, and she would always say, I'm going to take care of this, you just focus on you. So I was able to focus on my health and what I needed to do, and Mindi took care of the rest. And I call it noise. She took care of the noise.
Mindi, can you tell us a little bit about what you and your colleagues do? What are your priorities? How do you get through a day?
Absolutely. So at Sanford Health Plan, we have what's called a care management program. It's a group of qualified individuals that specialize in a variety of different things. Within our program, we offer services to our members at no additional cost to their benefit plan, and those services can range from healthcare needs of all sorts, whether that's complex case management, transitional care like leaving the hospital, which was what Robin fell into, ER services, end-stage renal, oncology services, and more. Social work services, it's very individualized and unique to the member. And so we recognize that going through a medical condition is challenging and it's scary, and we want to be there to support our members in any way that we can. And we also recognize what a challenge it is navigating that while you're at home. And so our services are done completely telephonically over the phone. We're not there to take place of their care team, we're just there to help support. And that is individualized and based off of whatever the needs of the member are. And so we usually just do a phone call or two to those members once they're at home. We work towards helping them meet their goals. We help them navigate the system. We help provide resources for those that, for depending on or varies whatever the patient may need.
Now, we've heard about this infamous initial phone call. From your perspective, how did that phone call go? I'm just essentially asking because this is how you and Robin hooked up.
This was our first initial call. She had been recently discharged from the hospital, which fell into my specialty of work. It was a few days after a hospital stay, so my goal was just to touch base with her, see how she's doing. We offer our services available to any member, regardless if they've been in the hospital, regardless of what their condition is, but that service is offered to them and they can take it or not. And so I had called Robin, explained who I was, what the purpose of our call was, and just after a few minutes of talking together, realized she was having an episode of high blood sugar, which was new for her. And so we talked a few minutes on the phone, and that's when I directed her to the ER just based from a safety standpoint. Her blood sugar was over 500 at the time. And so we left that conversation with the intent of, you're going to go to the ER, I'm going to call you in a couple days and check in, and we'll see where this goes from there. So that was our very first initial encounter.
How did you come upon this part of that this was something you wanted to do with your career?
You know, I've been a nurse for about 16 years. All of that career has been within Sanford. The last 2.5 years have been within the health plan, but previous to that, I worked in a clinical setting, a clinic that was pediatrics, family medicine, internal medicine, and OBGYN. So I have a wide variety of experience, but I really enjoy making that personal connection and trying to help patients when they need it most. And so this career allows me to do all of those things. So it's an interesting career. We certainly don't always have every initial encounter happen that way, where it involves, a medical crisis. But when those do happen, it's very rewarding on my end as well.
I would guess that for a lot of people, you have to explain to them exactly what the types of things that you could really help people with, and perhaps they aren't aware initially that people like you even exist. I would guess that would be part of it too, that to make sure that they know that these are things I can help you with and you should seek me out or one of my colleagues.
Absolutely. And that's, the whole message behind this is that when you're going through a medical condition or a crisis of some sort, the hardest job is to take care of yourself. We want to take that load off for you. You should just be able to care for yourself. You shouldn't have to do the work of knowing what you need, when you need. We have resources and professionals, even within your own health insurance, that could help you through that. And so that's the whole point of the story, is that we want you to know that you don't have to go it alone. We're here to help support you in any way we can, and we're not meant to know every answer, but we're meant to guide you along the way.
Tell me a little bit about Robin and the rapport that you've developed with her over this time. And obviously it's something kind of special. That's why we're here today.
That first call to Robin, certainly I make dozens of phone calls every day, so they're not always this type of story. But that first call, she graciously picked up the phone. I explained what I was there for. She's a rock star in every stretch of the imagination. She listened. I listened back. We talked about what she was going through. I think we were probably only on the phone for about the first 5 minutes when the answer was, I'm not a doctor, but my advice, if I were you, is to go to the ER. And she accepted that advice. She followed it. I mean, she has done all the right things in terms of what a patient should do. She's put her trust in me just as much as I've put my trust within her. And so, anytime that you go through a medical crisis alongside somebody, you're pretty bonded right off the bat. That first call really got our feet wet. Every call after that, has only gotten us closer, and, we've established a really good rapport and a really good bond. And I'm just grateful to be part of her journey. This is her journey. She's a true warrior through this, and she has defied a lot of odds. And the fact that I'm just able to assist her is really what fills my bucket to being a nurse every single day. When you know that you can help people, and when you know you've made a difference, it's one thing to be successful, but it's another thing to be impactful. And it's filled my cup just as much as it's helped hers.
Robin, ongoing, when you're thinking about how this has gone to this point, and somebody was going to just ask you, well, how's it going? And what are some things that you could tell people that you've learned about the health system, about your cancer, all those things, about Mindi? What are some of the things that come to mind right away?
How much time do we have? I would not be here today if it wasn't for Mindi. And, she will not readily admit that. I mean, seriously, when she sent me to the ER, I walked into the ER DKA. And what that is that means that I have too much sugar for too long in my bloodstream, and it is potentially a life-threatening situation with diabetics. And it was only because I showed up to the ER, like Mindi said, my blood sugar was pushing 600, and we don't know how long it had been high. I was put on in the ICU and put on insulin drip. And if I would have waited, I might not be here today because of the DKA. Mindi has helped me in so many other ways and taken the stress off. Like, she just made sure that before I showed up for any appointment, any scan, any test, any treatment, that the authorization was already there and I wouldn't have to worry about it. And that was huge. What I'd like to tell others about the Sanford plan is Mindi, other than my oncologist, Mindi was the most valuable tool in my toolbox. I've said it again, I don't know where I'd be. I tell everybody she's my rock star. If people aren't using this service, they are missing a very valuable tool in their fight, in their journey. I can't strongly urge them enough to reach out and find their case manager.
We're not just unique to oncology, that's the case here today, but if you are a Sanford Health Plan member, I would encourage you to reach out to the Sanford Health Plan if you're looking for resources or guidance or assistance with helping manage or navigate your condition, please call us. We would be happy to have somebody on our team visit with you and place you with one of our members that can help you through that. We don't want you to be alone.
You can connect with the Sanford Health Plan team to learn more or enroll in a program. You can call 888-315-0884.
This episode is part of the Health Insurance Simplified series by Sanford Health Plan. For additional podcast episodes by Sanford Health Plan, find us on Apple, Spotify, and sanfordhealthplan.com.